Mr. President, Ms. Breadbanner, and distinguished guests, first let me welcome each of you to the White House, especially today's guests, all of whom are praying that the adults keep their remarks short and snappy. So before we start, I think you all should wave to the cameras to make sure that you get on the cameras, okay? I'm going to do my part to keep this very short and snappy. First, let me acknowledge the many guests that we have here, particularly the leaders of advocacy groups who have stood with you, Mr. President, on these very important issues. The American Academy of Pediatrics, the March of Dimes, is represented here by Jennifer House, their president, the National Association of Children's Hospitals, the Children's Defense Fund, represented by their president, Marian Wright Edelman. President Clinton generously sent me to the first week of the Olympics. And as you know, at the opening ceremonies, the members of each delegation actually dress the same. The shirts that they wear send a message to everyone. And the shirts that these young people are wearing today also send a message to everyone. It's a message that Congress needs to hear. Insure kids now. Now, can you all say that? Insure kids now. Say it again. Insure kids now. That's the message. It's the same message. It's the same message that the President and the Vice President and this entire administration have been saying loud and clear since we first got on our jobs. And that's why we've created the State Children's Health Insurance Program with the Congress, which is now up and running in every state and territory. Under the President's leadership, we continue to make this program better. We've approved over 50 amendments to state plans. We're helping communities streamline their applications, break down barriers to enrollment, and increase the number of eligible children. So we are absolutely committed to finding and helping uninsured children, not only through the state children's health insurance program, but also by expanding Medicaid outreach so that no child who is eligible for Medicaid falls through the cracks. But as much as we love children, the President's agenda has always been about increasing access to health insurance for every American who needs it. And we've done just that. 8 years ago, before President Clinton signed the Kennedy-Kassebaum law, if you lost your job or got sick, you could lose your health insurance. But we've changed that. 8 years ago, if you aged out of foster care, your Medicaid coverage ended. But we've changed that. And 8 years ago, if you were disabled and wanted to go back to work, you had to give up your Medicaid or Medicare, but we've changed that. So we've come a long way in expanding access to health care, but we're not home yet. And unfortunately, we cannot do what Dorothy and the Wizard of Oz did, just click our heels together. Instead, we have to put our heads together and make sure that working families get the coverage they need. And I'm talking about parents like Debbie Breadbanner. Mrs. Breadbanner's 2 children have coverage under Maryland's S-chip. So she understands the blessing and the security of having her children protected. But she also understands the fear of not having insurance for herself. It's both a heartwarming and I think a harrowing story. And I'm very pleased to introduce the person who is here to tell it. Debbie Breadbanner.
Thank you, Secretary Shalala. Good morning, Mr. President and other distinguished guests. I'm here to share my story with you so that you will understand how important health insurance coverage is to me and my children and to millions of families across the country just like mine. Mr. President, I know that thanks to your leadership, my family's a lot luckier than most. Because of the CHIP program, we have insurance for our kids. The most important thing for me as a working mother is to make sure that my children do have health insurance. My children have been enrolled in the Maryland CHIP program for 2 years now, and I want to tell you, this program's been honestly, a blessing to me. It just helps me so much. Bryant, my son, has asthma. He uses inhalers and sees the doctor regularly. But without careful monitoring, his asthma attacks could spiral out of control. But because of the CHIP program, we can afford the medicine that we have to keep on hand without going broke. My daughter Melissa over there is a pretty healthy toddler, but she needs to see her pediatrician regularly like everyone else, other children. But because of the Maryland CHIP program, she gets the preventative care she needs to stay healthy. And I know if she were ever to get sick, we'd be able to afford to take her to the doctor. Recently, we had a scare with Bryant. The doctors thought a few weeks ago that Bryant had viral meningitis. Thankfully, he's okay, but we were in and out of the hospital together for 3 days. And thanks to the CHIP program, all I had to worry about is him getting better and being diagnosed, and not how will we pay for the care. Mr. President, you know how it is being a parent. You care more about your children than your own self. And if I had to choose between having health insurance for them or for me, I'd choose them every time. Frankly, we cannot afford to purchase health insurance for me. I wanted to sign up through my company, but it would mean over half of my paycheck would have to go to premiums for the first 3 months, and then a third of my paycheck each month after that. Mr. President, my husband and I are trying to support our 2 children. We can't afford to lose a third of my paycheck each month, so therefore I have no health insurance. I'm very fortunate to have good health, and I don't need to see the doctor often. But because I do not have insurance, I'm even unable to go to the doctors right now for my regular checkups. Recently, I had to go to the doctors for an attack of bronchitis, and I paid out of my pocket. And I thought, what would happen if I really got sick? I am getting older. It would devastate my family financially, and also I just hope I don't get sick. Excuse me. Mr. President, I've worked all my life, and I want to make it clear that I don't want a handout. It would be a big relief if I had access to health insurance also, so that I would know then that I would be able to be there for my family. And I know that every day you're in the office, you're working to help us with that. And now it is my honor to introduce someone who has fought harder than anyone else to ensure the America's family has access to affordable, high-quality health insurance. The President of the United States, William Jefferson Clinton.
Great. Thank you very much. Thank you. Good morning. Thank you, Debbie. She did a good job, didn't she? Let's give her another hand. Thank you. I would also like to ask the rest of her family to stand, her husband Chris and her son Bryant and her daughter Melissa. Let's give them a big hand there. There they are. Thank you for being here. I also want to thank the advocates whom Secretary Shalala mentioned, and 3 elected officials who have strongly supported our efforts. First in the Congress, Representative Sandy Levin and Representative Robert Underwood. Thank you for your help. And Linda Kropp from the D.C. City Council, thank you for being here. Let me announce before I get to the subject at hand that I just signed the continuing resolution which Congress sent me yesterday, necessary because our fiscal year ends tomorrow and we have to have a stopgap funding measure for the government to run. But I hope we can now pass the remaining appropriations bills. September has come and gone, and Congress still has obligations to fulfill. These children behind me have been back in school for a month, but we still don't have the first assignment turned in from Congress, ensuring that our schools have the resources to meet the high standards we expect of them. Now let's get back to this story. Deborah's story is all too common in America. There are millions of our fellow citizens like her and her husband, who get up every day, go to work, play by the rules, and still have a tough time finding affordable health insurance. For 8 years now, Secretary Shalala and Hillary, who I wish could be here today for this happy announcement, and I have worked as hard as we could to make sure families get more health insurance. Yesterday, we have more evidence that our approach is working. The census data shows that the number of uninsured Americans fell by 1.7 million in 1999, the first major drop in a dozen years. Nearly 2/3 of these newly insured are children, like many of those who are here with us today. Since I signed the CHIP program into law, 2.5 million children have been able to get insurance through this program. In our budget, Vice President Gore and I proposed a family care initiative which would take care of the second part of Debbie's statement. It would expand CHIP to cover the parents of eligible children. If we do this, we could cover a quarter of all the uninsured children and families in America. And I might add, those that are most at risk and need the health insurance most. Parents like Deborah and Chris Redbender know what a difference health insurance can make. You just heard it. Not just in emergencies, but for routine care. Consider the child who doesn't get treated for an ear infection, who might suffer permanent hearing loss, and certainly, while in pain, would have a harder time learning in school. Consider the toll of untreated asthma, which will cause American students, listen to this, to miss 10 million school days this year alone. That's why we need to keep pushing forward until all our children are covered. To help accomplish this, the Department of Health and Human Services is awarding $700,000 in grants today to develop new and even more effective ways to identify and to enroll uninsured children. These grants will be used not only to get children enrolled, but to keep them enrolled so they can get the care they need. They will build on our recent success in improving outreach and enrollment around America. If you look at how the states are doing with CHIP, you'll see that those with the best outreach programs have the most success in boosting the number of children covered. States like Indiana, Ohio, and Maine have done a remarkable job. I hope others will look to them for leadership. There was a story in one of our major papers yesterday outlining the dramatic differences in enrollments from state to state and making it clear that the states that had the most systematic, determined effort and a strong leader got kids enrolled, and those that didn't try as hard didn't. This is a simple matter of systematic effort and real dedication. I also hope that every working parent searching for children's health insurance will call the toll-free number on every one of these children's T-shirts, 1-877-KIDS-NOW. We need to remember that the rising number of uninsured didn't develop overnight. It won't disappear overnight. In some ways, it reminds me of the challenges we faced when Vice President Gore and I took office in January of 1993. Some people said there was nothing we could do to stop the rising tide of red ink. The numbers on the national debt clock in New York were flashing so fast, people's eyes were glazing over. But we made some tough choices. We cut some spending. We raised some money. We invested in the American people and eliminated hundreds of programs we didn't need. And together, we turned a $290 billion annual deficit into $230 billion of surplus this year. That didn't happen by chance, it happened by choice. That's what is happening now with health coverage. If we make the right decisions, if we make smart choices and see them through, we can reduce the number of uninsured people in America. First, as I said, it's very important to recognize that the laws on the books, we believe, would enable us to insure up to 2/3 of the uninsured children in America, 8 of the 12 million. If every state did everything possible to enroll children in the CHIP program and got those who are Medicaid eligible into Medicaid. Second, we ought to expand CHIP eligibility to the parents of these children. It's very important. Third, we ought to focus on another group of people that are having great difficulty getting health care, those who are over 55 but not 65, therefore not old enough for Medicare. And many of them have taken early retirement or lost their jobs, or they're working in a place where the employer doesn't offer health insurance coverage. We think they ought to be able to buy into Medicare, not to weaken the Medicare program. Our proposal is give them a tax credit to defray some of the cost of buying into Medicare so that we would in effect cut the cost for them of buying into Medicare, but get the whole amount of money into Medicare so that it would in no way, shape, or form weaken the financial stability of Medicare. This is very, very important. And I might say to you, we ought to do this now because this group is only going to get larger as the baby boomers age. Next year, Exhibit A, the oldest of the baby boomers will be 55. And for 28 years after that, you will have some portion of the baby boom generation in that 55 to 65-year-old age group. It's very, very important that we do this. Next, Congress should pass our tax credit for small business to strengthen their hand in negotiating quality, affordable health insurance options for their employees. A lot of businesses try to offer health insurance, but as you just heard Debbie say, the cost to them is so high, and they have to pass so much of the cost on to their employees that many of the employees can't afford it, even if it's offered. Next, Congress should restore Medicaid benefits to the most vulnerable of our legal immigrants, including children. A few days ago, a bipartisan coalition on the House Commerce Committee voted to pass this important measure, and I applaud them for doing so. Surely now that the committee has supported it, we can work together to restore these benefits and do it this year. Finally, there are some other items on our agenda. The American people still need Congress to pass a Medicare prescription drug benefit, a $3,000 tax credit for long-term care, very important for families that are caring with family members who are disabled or aging, who have long-term care needs, and a strong Patients' Bill of Rights. You know, when Hillary and Donna and I started working on this back in 1993, we proposed a solution that would have covered all Americans, would have the Patients' Bill of Rights, would have the provisions of the Kennedy-Kassenbaum bill, would take care of children who age out of foster care. And it was too much for the system to accommodate at once, so we've gone back piece by piece trying to achieve that. We have now the children's health insurance coverage. We've taken care of the kids that age out of foster care. We passed the bill that protects you if you get sick or if you change jobs from losing your health insurance. But we need for people to make maximum use of this law. Every child in this country, like the children standing here, and like the breadwinner kids who's eligible for CHIP, ought to be in it. The parents who need it ought to be able to buy into the program. We can afford this now. It's quite manageable. And we absolutely know there are only two ways that you can provide health insurance for working people on modest incomes. There either has to be some sort of subsidy from the government, or the employers have to provide it, or you have to have a combination of both. Next, we need to deal with the 55 to 65-year-old age group. And finally, we need to deal with the fact that there are so many of our seniors who don't have prescription drug coverage, and we need to deal with the long-term care challenge facing our country, and we need to pass this Patients' Bill of Rights that we've been working on since 1994. This is all very, very important. The good news is we know this approach will work. We know that the number of uninsured is going down, and I might say we don't have the figures yet, but we know there are several 100,000 children who, because of the CHIP program, have been enrolled in Medicaid. So we just have to keep working on this. So I implore you to make sure every state in this country is making the most of the laws that are here, and to do everything you can to get Congress in this time of unprecedented prosperity that enables us to do things. We could not do this 6 years ago because we did not have the money. We now have a surplus. We can do this, still have a reasonably sized tax cut to help people with education and child care and saving for retirement, and pay this country out of debt in 2012. We have the money to keep America's economy going, to get the country out of debt, and to provide more health insurance to families like those that are represented by these children here today. We ought to do it, and do it now. Thank you very much, and God bless you.